In Part 3, I will consider what I have termed the normal response model as elucidated by Professor Kaplan. Though Professor Kaplan's concerns regarding the pathologizing of the invisible wounds of war are well-founded, her normal response model, I fear, may exacerbate the plight of veterans still further. First, to characterize veterans' disturbed and lasting emotional response as normal may be misunderstood and or exploited by the uninitiated and, more importantly, by those concerned more with budgetary constraints than with the well-being of veterans. Consider, if A, veteran difficulties are merely clusters of normal personality and behavioral responses to battlefield conditions, clearly an abnormal situation, and B, the traditional clinical psychiatric methods utilized by the VA are costly and ineffective, even detrimental to healing, and C, if veterans' needs can be better met by volunteer, sympathetic civilian listeners, then I fear that Professor Kaplan's program, though certainly well-intentioned, will lead to cuts in VA funding and other critical veteran programs. Further, I believe it diminishes an appreciation for and understanding of the scope and seriousness of the invisible wounds of war, raising the question during this critical economic crisis and with waning support for the wars and subsequently for the warrior, as to why we need to continue to spend billions of scarce resources compensating veterans for behavior that is normal. And finally, and perhaps most importantly, from the veteran's perspective, the veteran, she understands that her life has changed dramatically since returning from theater. She realizes as well that she doesn't fit in any longer, feels anger and shame and frustration, is alienated and alone. So while a veteran may prefer not to think of herself as mentally ill, she certainly understands that something is not right, that her feelings and behaviors are not normal, that is, as they were before. In regards to the efficacy of Kaplan's Listen to a Vet program, here again I would offer some personal experiences to corroborate my point. It is clear that many veterans choose, for any number of reasons, not to discuss their experiences in war, especially with those who were not there. Others, however, feel obligated to do so. Together with many other members of Veterans for Peace, for example, I have spent many years talking to students, church groups, community organizations, basically to anyone who would listen, about my personal experiences in war, and in so doing, about war's nature, its reality, and consequences. Now I do so to educate and to enlighten, believing, at least initially, that war was a deficiency of information, understanding, discernment, and vision, and that those who make war, or support war, or just ignore war, do so because they just don't understand its realities. But with age, experience, and study, I have realized that war is not a deficiency at all, but an excess of greed, ambition, intolerance, and lust for power. And we, the warriors, are as instruments, the cannon fodder, expendable commodity in the ruthless pursuit of wealth, power, hegemony, and empire. Despite this realization and the discomfort I feel while standing in front of a group of strangers, sharing with them my most secret and distressing feelings, nightmares, and flashbacks, I continue to do it. Not because it is curative or purgative or cathartic, but because it is necessary. Many of us who have seen humankind at its worst realize a responsibility to continue to sacrifice, to work for war's eradication. Or perhaps we do it as retribution, as penance for the sacrilege of war. I think it is accurate to say that no matter how many times we relate these incidents and experiences to civilians, or how understanding and sympathetic the listeners may be, it never gets easier. It is always overwhelming takes a great personal toll and requires many hours to regain our calm and composure. Professor Kaplan is right, however, in stressing the importance of listening. Should a veteran, for example, especially a family member, feel inclined to discuss her experiences in war, what she is feeling, and so on, by all means have an open mind and listen, despite the fact that you may be made uncomfortable by what she has to say, by what she has seen and done while in war, and despite the displeasure you may feel with the realization that as a citizen in a democracy, you must bear some culpability for a war being fought in your name and for the injuries she has incurred. Have some courage, accept some responsibility, and listen to what she has to say. Feel fortunate for this opportunity to learn and that she is willing to share with you such personal and troublesome feelings and experiences. Here I believe Professor Kaplan's guidelines for listening will be helpful. But what is crucial to note is that while not listening will send the wrong message to the veteran, that she did was wrong, unimportant, of no interest to civilians, thereby exacerbating her distress and anxiety. Listening, even compassionately, understandingly, and non-judgmentally, is not in itself the elusive cure that has escaped us these many years. What I would strongly advise against, therefore, is Professor Kaplan's suggestion that civilians seek out veterans and invite, even encourage them to share their experiences, impressions, and feelings about war in a well-intentioned attempt to help. What Professor Kaplan seems not to appreciate is the extent, severity, and complexity of the veteran's injuries. Not only will such an encounter not be beneficial, it may well be harmful, especially to young veterans who have yet to begin the work of sorting out the experience and may be coaxed by well-meaning listeners into uncharted and dangerous areas accompanied only by civilians, individuals who have no idea about the nature of war and what they may encounter while on this journey. It is probable under such conditions that neither the veteran nor the civilian will benefit. Now perhaps this may sound rather cynical, but contra Professor Kaplan, my advice to civilians would be to just stay out of the way and do no harm. Realistically, they are ill-equipped to help, as, and I know this is cliche, they just weren't there, and therefore cannot understand, more importantly, cannot feel what the veteran is experiencing. We hope that civilians will become educated about the nature and the reality of war and its effects upon those who experience it, mainly so as not to be misled should some other megalomaniacal leader again attempt to send our children into harm's way. It is not, however, the veterans' responsibility to provide this education, though veterans' voices can be an effective and powerful tool. Nor does their healing require civilian understanding, sympathy, or compassion. Nor is healing enhanced by civilian appreciation, respect, and admiration. An important part of healing is for veterans to confront and then to work through the enormity of the experience of war, the trauma, and the moral realization that they have participated in an enterprise whose only purpose is to kill and mutilate other human beings for a cause that is at best legally and morally questionable and ambiguous. On the road to understanding and to healing, when a veteran has finally put aside the mythology of war's glory and nobility, she cannot help but see war for what it truly is: brutality, cruelty, and a violation of all that she and most of society hold sacred and right. So appreciating and thanking a veteran for her service, calling her a hero, is counterproductive, as it creates a distraction from the difficult task of confronting the moral enormity of the enterprise of war. That is, it provides a sanctuary of sorts, the mythology, to which she may escape when the healing journey gets tough and threatening, and it will, as it is much preferable and comfortable to think oneself a hero, flawed though we may be, than a murderer and a dupe. Besides, all such gestures of respect and appreciation are in reality a charade, insincere, pseudo-patriotic talk intended to hype sales at the mall and to entice other young, naive people to believe that war is glorious and heroic, and to lure them into military service to become the tool and cannon fodder for future wars for profit and power. Unfortunately, healing and coming home are difficult, complex, and perilous journeys of introspection and understanding. So while it is important that veterans not be ostracized, shunned, or ignored should they want to talk, if healing is to occur, it must be with the help of others who have shared the experience, who know the horror firsthand, and not through telling war stories to well-intentioned but voyeuristic civilians. I believe as well that professionals have a place in sorting this out, perhaps as therapists proficient at staying out of the way and steering the veteran in a direction of healing, and as ethicists who can help to understand and gain a perspective on morality and moral integrity.